Welcome to Akron Buzz, everyone. I'm your host, Sarah. Today I get to hang out with David Thomas. David is a case manager for Comprehensive Behavioral Health Associates. How are you, David?
I'm good. How are you doing, Sarah?
I'm doing fine. So we're going to find out all about what you guys do.
Okay.
You have a new Akron branch, so
Yes.
that's why we're bringing it here to Akron Buzz, and we'll talk about that here in a little bit. But what do you guys do at your facility at Comprehensive Behavioral Health Associates?
We offer counseling, meds, and case management.
Okay.
They generally work together hand in hand. We have the most amazing team of case managers. A case manager, if you were to use like a football analogy, is like the linebacker, and
Okay.
the client is kind of like the quarterback. We run interface for them, we advocate for them, we connect them to resources. And during this world pandemic, the case managers have been the ones that have been out delivering food, delivering clothing, helping people get applications filled out, get connected to resources. We have a very amazing team that I'm proud to be a part of.
Yeah, and so you were telling me you already have 4 different locations. You have Austintown, Boardman, Salem, and Alliance.
Yeah.
And then opening here in Akron. So tell me a little bit about if someone is struggling with their mental health and they wanted to come to you guys for help, what would that look like?
If they were to contact us, we would try to set them up with an appointment with a counselor who would talk to them and see what's going on and see what services that we provide would help them the most, and then we plug them in from there.
Yeah, I feel like we were chatting about this
Yeah.
before the show. I feel like this is such an important topic right now.
Correct.
People are struggling with their mental health.
We are definitely a world that's in a mental health crisis right now.
Yeah, can you share a little bit more about that and maybe even give someone an encouragement who maybe needs to take that step?
Yeah, I would say that the thing right now is to overcome the stigma of seeking help.
Yeah.
We just sort of think, well, we can just do this on our own. And honestly, right now, I would say we can't.
Yeah.
You know, we are all in rough shape with what's going on, and we're only human.
Exactly.
And we're experiencing, I've never been in a world pandemic before. No one else has here either.
Right.
And this is very scary times, and you're only human, and it's going to affect you in wild ways. And it's okay to reach out to people, counselors, etc.
Yeah, I totally agree. I know we were chatting too about how, it's so easy to either go one way or the other, kind of realize, okay, I do need help and I am going to reach out.
Yeah.
So
I think there's a huge rise in substance abuse, and you're seeing every corner has a CBD store.
Right.
So people are self-medicating in one form or another to try to cope with the stressors of what's going on.
Right, absolutely. And you guys can give them some tools
Yes.
to be able to move forward in healthier ways.
Because you don't want to fall into a rabbit hole of substance abuse.
Right.
It will not fix the issue and help you in any way.
Right, absolutely. And most people, it's not that they want to do that, it's that they are trying to cope, and so you can give them some coping tools for
Correct,
sure.
yeah.
Absolutely. So how did you get into this? I always like to check out people's backstories. What made you be interested in helping people with their mental health?
I started off, I was orphaned at about 11 years old, and I grew up on the streets as a kid.
Wow.
And I just sort of, in my mind, I stayed away from drugs and crime, and I just sort of, in my mind, I was like, I want to do better than this, and I want to fight for a world where children don't grow up the way that I did, like in extreme poverty and lack. And so I went to school, I studied social work and psychology, and then I went and did some nursing, which was awesome. The foundation of who I am comes from being mentored in nursing.
Yeah, absolutely.
I had some amazing nurses that kicked my butt, taught me how to care and to love people.
Yeah. I
and
can see how those relate for sure.
Very much so. I highly recommend anyone going into social work and psychology to do a stint as a STNA. That's their nursing assistants.
Okay.
That will develop some amazing skills when it comes to empathy and working with other people.
Yeah, for sure.
Yeah.
And so that brought you to this place today.
Yes, correct.
So as a case manager, are you doing any of the counseling and that kind of thing, or
No,
are you just managing the whole
What I
thing?
do is I run interface. I try to get clients out of their house, get them physically active.
Okay.
I do a lot of walking with clients just to help them. I logged about I logged a marathon a week last year.
Oh my gosh,
Yeah.
which is really cool too.
Yeah.
I mean, you're getting some exercise,
I'm getting some exercise too. Yeah.
and they are as well.
Yeah.
So on the website, so we'll share the website. You actually have a show called Let's Talk Mental Health.
Yeah, we have a little show called Let's Talk Mental Health where I interview the people that I work with, and they talk about the different things they do and the different services that they provide.
Okay, that's fantastic. So go ahead and share the website so people can check that out.
That's comprehensivebehavioralhealthandassociates.com.
Perfect.
Yeah.
And then, do you guys have social media if people want to
Yeah, they're
check
on
you out?
Facebook as well.
Okay.
Yeah, and then some of the interviews are there as well.
Great.
So, yeah.
All right, so before we wrap up though, I want to go to a paper that you wrote.
Yeah.
It was actually called Psychological Effects of the COVID-19 Pandemic on Children and Adults, which is, we talked about a little bit, super intense topic.
Yes.
But let's just talk a little bit about that. What did you find out through writing that paper?
My colleague, Christy McAllister, and I wrote a paper last year, and it got published by the United Nations Department of Social and Economic Affairs.
Okay.
And the findings were just devastating. Like
I'm
the
sure,
effects of what's going on, economically speaking, how it's affecting our children, suicide rate with children.
Oh, yeah.
I just read a CDC report about the upspike in teen female suicides.
Breaks my heart.
It's insane.
Yeah.
It's so sad. And so this, we are focused on COVID and virus, but the scary thing is there's this mental health crisis that's going to domino and we don't know for how long.
Right.
So my hope with writing the paper with my colleague is to start the conversation and try to get in front of big people to create programs, because we're all going to need some kind of help.
Yeah, absolutely. I would think, going into schools and talking about this, going into, colleges, things like that would be super important.
Yeah, I would like to see mental health accessible everywhere.
Yes, absolutely.
And for everyone.
So go ahead and share with us a little bit more about the new Akron branch. You have a phone number for us if we want to do that, and an address, and people can also go to your website to find out more.
Yes.
Great.
We just opened our Akron branch at 275 West Barches. That's here in Akron. The phone number is 330-470-6714. We have an amazing counselor that works there. Her name is Asia Goff.
Okay.
It's just going to be amazing, and hopefully to serve the people in Akron for their mental health needs.
Yeah, absolutely. And I think, like we said at the beginning, we can always use help. So reach out, you guys. If you need help, reach out.
Yes.
Can you give just a few tangible things other than reaching out? Obviously, that's number one and important. What are a few tangible things that maybe someone who's struggling right now, they can't get an appointment for a week, what could they be doing?
I would say exercise. Do things like yoga. There's tons of home workouts that exist. Break a sweat every day.
Yeah.
Do things to help you feel good. Take care of your own self-care, and don't do things that are temporary fixes, like drinking or using illegal substances.
Right.
Things like journaling, just writing out what's going on in your head, privately, just for you. Just take like 4 pieces of paper and just in the morning, just fill it out with whatever you're thinking, just to help you.
Yeah, I love that. Those are some great tips. I know my counselor calls that a brain dump, where you just dump it out.
It is awesome.
And it's so fantastic. I love it.
I do a thing I call 4 in the morning. And I do 4 pages in the morning, and I just sit down with a pen before my feet hit the floor, and I do anything, and I just start writing.
Yeah.
Whatever comes to mind. I just to dump it out on the paper.
Absolutely. And if people don't want to keep it, rip it out, throw it away.
Do whatever you want to do.
Do what you want to do with it. Yeah, I think those are great ideas. And moving helps so much. It actually reminds me, it's really silly, but it always reminds me of a Legally Blonde quote where she says, exercise creates endorphins, and endorphins make you happy.
That's correct.
So we want to, create those endorphins for ourselves.
That's one of the things I try to do is get my clients out of their places that they're staying by walking, because the danger is we get trapped here. We're on a steady diet of social media fear and news.
So true.
And you can just fall into a rabbit hole.
Yep.
And it's important to shut that off and get out.
All right, I love those ideas.
Yeah.
So we'll direct people to your website and to your social media. Thank you so much for being here with me today,
thank you.
David. Yeah, it was great talking with you. Thank you guys so much for being with me here today. I hope you go out and do some of those things. Take a walk, exercise, journal, do a little brain dump, and if you need to, please just reach out. You can reach out to David's program, Comprehensive Behavioral Health Associates, or one of the other many great places here in the Akron area. And we want you guys to follow us on Facebook, subscribe to our YouTube channel, and check out our brand new Roku channel. We'll see you guys next time. Bye, everyone.